set up here. Hi, everybody. Okay, there it is. That looks more normal. All right, so here we are. Today we are planning on talking about fleas and ticks mostly. Today I will probably actually focus more on ticks as far as parasites go, but I am more than happy to talk about other parasites as well. I'm also going to briefly touch on our preventatives that we use, why we recommend them, and then I'm also going to go into a little bit on the differences of some of the different types of preventatives out there. So to kind of just jump right into it, let me make sure I don't have anything here. Okay. So to kind of just jump right into it, why do we care about fleas and ticks? Okay, so fleas and ticks are both external parasites, or parasites that will go on the outside of the animal. You can see them. They do bite people as well. As far as the ticks are concerned, we are just as good of a host as the animals. As far as the fleas are concerned, they actually prefer the way that our dogs and cats taste, so they really only jump on us when there's a really bad infestation of those. The big difference there is that ticks' eggs will hatch regardless of what blood supply or blood meal that they have, whether it's on a human or a dog or a cat. Whereas with fleas, particularly our cat flea, which is the type of flea that most commonly affects our dogs and cats, they need to actually feed off of a dog or a cat in order for their eggs to hatch. So we're not really their ideal person to bite because it's not going to get them anywhere. The reason they want the blood meal is so that their eggs will hatch, so they really prefer to bite our dogs and our cats. To kind of finish, little overview of fleas that a lot of people don't think about is with the fleas, after they bite, they don't lay their eggs on the animal. They jump off and they lay their eggs in the environment. They usually lay them in between your couch cushions, in your curtains, in your carpets, all these little nooks and cranny places around your home. So that's why fleas can be really hard to get rid of once you get an infestation in your home, is because you have to wait for all those eggs that were hatched out in your house to hatch, and then you need those adult fleas to die. So that's why even if you put a pet on a flea preventative, you really need to wait and keep them on that continuously for about 3-4 months to break that flea life cycle. And what that does is that lets all the eggs in the environment hatch, turn into adults, bite your pet, and then die. Okay? And then once you get it cleaned out, I always tell people I would definitely recommend keeping them on a flea prevention, but if you do stop and you get fleas again, at least you know they're new fleas. They're not the same fleas you've been fighting the whole time. So there's that. So those kind of fleas, at least in this area, is something that we've been fighting for a long time. They haven't really changed that much. Ticks, on the other hand, here in Carroll County anyway, have become much more of a concern. The past few winters really haven't been as cold consistently as in previous years. So we still get cold days, we still get maybe up to a cold week, but very, very rarely do we ever get a month where it actually stays cold. And what does that do? Well, for both our fleas and our tick population, what that does is it allows those parasites to breed year-round. Okay, historically, come fall, we get that first frost, and then it would stay cold. So they weren't able to breed and reproduce and make more of themselves until next spring. So we got this nice break in the wintertime. Because it doesn't stay consistently cold, every time it warms back up, the fleas and the ticks are able to breed again, they're able to reproduce, and so it just builds on their number. So instead of getting this winter break from the breeding season, they actually get to breed year-round. And because of that, we recommend the protection against them year-round, because we never really get that break. And then additionally, what that does is that increases their overall population numbers by a significant amount. And so we're seeing more and more of a problem. The reason I'm focusing on ticks so much is because Lyme disease is carried by ticks. Lyme disease was something that historically we never had to worry about here in Ohio. It was, oh, that East Coast thing that's over there. Lyme, Connecticut, they have all that weird stuff. It's moved, okay? So whether you believe in climate change, whatever, global warming, it is warmer here than it used to be. Our ticks are breeding more than they ever have been. And with that, these diseases are moving, okay? The ticks are moving and everything. And it's not just so much the ticks, it's also what actually carries Lyme itself. So what is Lyme, all right? So Lyme is a spirochete. Its fancy name is Borrelia burgdorferi, which is a tongue full. It's definitely a tongue twister. And that's not really the important part. The important part is it is this infectious agent, for lack of a better word, that the ticks aren't born with. They're born as these little itty bitty things, okay? And the first thing that they chew on or they feed off of often isn't people. It's usually like a mouse and things like that. And it's that black-footed mouse, okay, that carries the spirochete and is like the real reservoir for it. And then the tick will bite it and then it will get infected. And this Lyme, this Borrelia, will live in the GI tract of the tick. And then once the tick has it forever, okay? It never gets rid of it. But it doesn't affect the tick. It just stays in its GI tract. So then what that tick does is it then goes and bites other hosts. And as the tick gets bigger, it likes to bite bigger and bigger hosts. And so then it goes from biting mice and little small rodents to biting deer, and then in our dogs and our cats and us, okay? And once it gets infected with it, it passes it to every single later thing that it bites, and it can bite lots of things throughout its life. Ticks have about a pretty complicated 2-year life cycle, okay? So unlike fleas, which they're a real big pain in the butt, but they have a relatively short life cycle, about 3 months, and then they're gone, okay? Ticks are around for 2 years, all right? And so once you get this one with it, it's going to spread it around to everybody for 2 years, and it's going to bite different hosts depending on how big it is and how old it is, and also how prevalent they are, okay? So just because usually humans and dogs are bitten by the bigger ticks, the little itty-bitty baby ones can bite us too. And they may or may not have Lyme, even when they're itty-bitty babies, okay? Depending on if they happen to bite a mouse before they bite you. And what that does is when you're doing tick checks, when you're looking for ticks, you need to look for something about the size of a poppy seed. Okay, and you will see these little tiny buggers, and they look like this little black dot, and you're like, what is that? What is that? And if you get really close, it has legs. And I always tell people, if it doesn't have legs, you're fine. If it has legs, that's a tick, okay? And so the little tiny baby ones are less likely to have Lyme because they've bitten less things, okay? Because they initially have to be infected with it, but they can still carry it, which means that even when they're itty-bitty baby ticks, they can still pass it on to you or your pet or anybody else, okay? So that's kind of why I'm focusing on ticks, is because we're getting more Lyme, we're getting more ticks, we're seeing more and more of a problem with this, okay? And so that brings us kind of looping back to our flea tick preventatives. I already mentioned we want to be on them year round, okay? And the reason is because it's becoming such a big deal. So to loop back to what is Lyme, okay? So let's take it back to there. So we have this infectious agent, this spirochete, right? And it living in the GI tract of the tick. The tick then goes and bites somebody, okay? It doesn't instantaneously transfer Lyme because Lyme doesn't live in its salivary gland, it lives in its gut. So it does have to be attached for a certain period of time before it can transfer. This is really gross, but the way ticks feed is they eat your blood, then they throw it back up, and then they eat it again. So that's how something that lives in the GI tract of a tick can get up and get into your bloodstream and infect you. Okay, so how long do they have to stay attached for that? We used to think they had to stay attached for at least 3 days to transfer it. And then it came out, maybe only 2 days. And now they're thinking maybe only 36 hours. And so every time they look at it, they're like, oh, maybe not so long. Maybe it doesn't have to be quite that long. So generally, we like to think if we can kill them within a day, or we can get it off within a day, we're good. If it doesn't look engorged, hopefully we're good. But we don't really know how long does it need to be attached in order to transfer this. So when it comes to getting rid of ticks, the sooner you get it off, the better. When it comes to getting rid of ticks on your pets that are covered in hair, and good luck trying to find something the size of a poppy seed on them, the faster the product you have them on can kill them, the better. Because then they're less likely to get a disease from them. So let's talk about the kill rates on these things, right? So you have, I'm going to break up our main flea tick preventatives into 2 categories. Our older topical preventatives and our newer oral preventatives, okay? And there's a big difference between these. One of the big differences, I'm going to start here, is their approval, right? So our older topicals, okay, so this is your Frontline, this is your Canine Advantix, this is your Canine Advantage, this is all of those. You can buy them over the counter at TSC, Drug Mart, Walmart, you see all these off-brands of them, right? If you look at how they're approved, those are actually approved for use from the EPA, or the Environmental Protection Agency. And the reason they're approved through the Environmental Protection Agency is because they're actually classified as pesticides. Okay, they're not classified as a medication. They're tested for efficacy, but if you took it and you sprayed it on a surface like you do a pesticide, does it kill it? All right. Now, they tried to do more when they initially came out with these to get them to hang around in the pet, in the fat glands and sebaceous glands, things like that, so it would stay on the surface longer and keep the pet protected and those types of things. But it never really got tested as that rigorously for specific use in animals, and basically they just said, okay, it seems safe and it seems effective if we spray it on the surface and it kills them. Okay. Now, the other ones, the newer products, the oral products, all those are actually approved by the FDA, or the Food and Drug Administration, okay? Those actually go through a much more rigorous approval process, okay? Because they weren't tested for efficacy based off of putting it on a surface and does it kill them. They were tested for efficacy of, if I feed this to an animal as a medication, does it kill it when it bites it? And then how fast does it do that? Okay, so there's a big difference between testing something in vitro or in an animal versus on top of a surface and seeing how effective it is for kill rates, concentrations, side effects, all of that. Okay, so there's big differences between the two, and I think this is kind of at the heart of how you still have your older topical products out there on the market that, in my opinion, are not effectively killing our fleas and ticks fast enough. Okay, I bet if I took that product and I sprayed it at a certain concentration over top of a surface, it would still kill them fast enough, which is why they still have that label. But when I actually put it on the animal and it's spread out across the surface, it does not seem to be as effective at killing them fast enough to prevent disease. We still see flea bite dermatitis. We still see Lyme disease, we're seeing anaplasmosis, there's another tick-borne disease, we're seeing all of these on animals that are kept on your topical preventatives. Your particularly frontline is the most common one we see, and I think that's just because it's the most common topical out there that people use. But we have also seen it with the Canine Advantics and your off-brands as well. So let's go to our orals, right? So these were tested, okay? Your main oral medications, the ones we carry here, is a Bravecto. It's a oral flea tick pill that's good for 12 weeks with an asterisk, okay? And the asterisk is where everything gets here, okay? So it's good for 12 weeks against fleas. It's good for 12 weeks against your main deer tick, which is the one that carries Lyme. Against the Gulf Coast tick, it is only good for 8 weeks, okay? And where does the Gulf Coast tick live? Well, you can kind of figure it out by its name. It's down south. Sorry. We don't really have that many of them up here, so we don't worry too much about it. So when we have people come into the clinic here, we recommend that they give the Bravecto every 12 weeks because our main worry is the deer tick spreading Lyme, and we don't really see many Gulf Coast ticks. If you like to travel a lot and you like to go down south and you want to take your pet with you, that's something that you should know about Bravecto. If you use that product, you really should give it every 8 weeks, okay? Is it safe to give every 8 weeks? Yes. That was tested. It's completely safe to give every 8 weeks, and it's very effective. Your other products, the other one that we carry here in the clinic is called Credelio. It's a oral pill again, and it's good for every 30 days. It gets all your tick species. It also covers fleas. It has a very fast kill rate. It's a newer oral product out there, and typically we tend to get better with time. So the newer the product, the faster the kill rate. And then also there's the safety factor as well. The FDA has been upping their requirements for safety on all of these oral products. So a lot of people think of an oral product, the first one that comes to mind is NexGard. It's been on the market for a really long time, right? It does work, it's very effective. If you look at its kill rates next to all of the other orals, okay, it's a little bit slower. Since we don't really know how long does it take to actually transfer Lyme, is NexGard still an effective oral? Probably, but I don't know. But if I can get a different product with a faster kill rate, I'm going for it. And so that's why I get asked that. That's why we don't carry NexGard here in the clinic. It's just because there's a different oral product out there that's very safe and it has a little bit of a faster kill rate, and that's what I want. I want that fastest kill rate I can get. Other oral products out there in the market is Simpurica. It has a very fast kill rate as well. That's a good product that's put out by Zoetis. And then there's a new product coming out, which is actually for cats, that is an oral product. So this is kind of a novel thing. The only other oral product out there for cats that did fleas or ticks was called from Fortis, and it just did fleas. The Credelio for cats also gets ticks, so you get fleas and ticks with this one. It is a monthly product. It's flavored, and by their studies anyway, it was very successful, and all the cats ate it willingly. Normally, I would say they're fooling, but they do have a different product out. This same company that made the Credelio cats called Onsure, which is a pain medication, and it's a flavored tab as well, and honestly, cats love it. Okay, so if you're somebody whose cat is crazy hard to get a topical on, and the way it was described to me is some cats, you know, feel like it's like pouring cold water down your back. They just do that, ooh, okay? And it usually takes at least a couple people to put it on. So if you're older too, and you have trouble physically holding your cat and parting the hair, if you got a really fluffy cat, I'm gonna say try this product, okay? It's good for 30 days. It's an oral, and by everything they show, they should take it willingly. So it should make life a lot easier. So definitely try that, especially if you struggle with the topicals. I know we have lots of people that come into the clinic here. We don't charge anything to put on a flea tick product. If you bring us a flea tick product, even if it's one we don't sell, we will happily put it on for you free of charge. We got lots of people to hold, lots of people to help, and we just want to keep everybody protected as possible. But this could be some way around that. We love seeing everybody all the time, but if you don't want to come visit me every month, put your cat's flea product on, give this a try. So we will start carrying that product here in the clinic probably next week, I believe is when they said it was going to be coming in. And then it should also be available on our online store as well. So definitely something to think about. Now, all these newer products I mentioned and listed off, they're all prescription products. Why are they prescription products? Well, they're prescription products because they're approved by the FDA, not the EPA. They're prescription products because it's approved by the FDA, they go through this very, very rigorous side effects things. And one of the things you'll see if you go and research these or you Google them is that with the class of drug that they are, okay, this isoxazoline class, there is a neurologic warning put on them. So if you have a pet that has seizures or a pet that is very prone to seizures, those types of things, you're not going to want to put them on an oral flea tick product. Or if you do, you're going to want to do it with caution, okay? And there's, based off the oral product that you're considering putting them on, some of them have been shown to cause more or less of propensity to seizures. And then it's also something that you're going to want to watch dosage-wise, administration-wise, and then also when the pet has it. You know, have I ever put a pet, a client of mine, a patient of mine that has seizures on an oral flea tick product? Yes, I have. It's a very, very well-controlled pet. They're typically on anti-seizure medications. And I picked the oral product that I feel is going to suit them the best. Okay? It's very individual, and I think that's part of the reason why these companies decided to make these prescription products. The other advantage to it that I've found is that when they're a prescription product, I have to require a veterinary client-patient relationship in order to sell you this product. So, what does that mean? That means that this dog or this cat has to actually be a patient of mine and be in my system and logged and registered, okay? And I need an accurate weight. I think that's the key to these, okay? Most people don't know how much their pet weighs. I don't know that well how much a pet weighs just staring at it, and I do it all day. For example, my brother's dog came to stay with us this past weekend. He's a small thing, kind of comes up about mid-calf. He's overweight, but, you know, I figured, oh, okay, I mean, he's a bit overweight, but, you know, he's probably not that big. Well, I brought him into the clinic because he just wasn't on any flea tick preventative, and if he's staying at my house, you definitely need one. So I brought him to the clinic, I put him on my scale. I expected it to show up with him being fat, maybe around 40, 43 pounds, something like that. He was 52 pounds. So that jumps into a different weight class on my flea tick product. So there's a 25 to 50 pound range, and then there's a 50 to 100 pound range. If I had just gone off of my gut looking at this dog because he was short and I figured he wasn't that overweight, right? He wouldn't have had enough. It wouldn't have been effective. So what happens when you do that? Okay, let's say I underdose something continuously with a flea tick product. You don't have enough of that drug flowing in its system to be completely effective before the next dose. All right, so, and it tapers. So I would continually keep this pet, thinking I was keeping him fully protected, on a subclinical dose. And so when my fleas or my ticks would bite this dog, they're going to get a little bit of the drug, but not enough to kill them. And that is how you get resistance. That is how things adapt to it. So I think that's also part of the reason why a lot of your over-the-counter flea tick products are less and less effective, is because, you know, you try to pick something up on your scale at home and put it down and get a weight that way, or you look at them and go, it's probably average cat size. I'll just go for this weight range. Okay, it may or may not actually be the right weight range. And so we might not be effectively killing these fast enough. And if things can survive a little bit of poison over a long enough period of time, the body will adapt and they will make changes and they'll get stronger. You know, the old adage, anything that doesn't kill you makes you stronger. Well, it really applies when you look at something over a species level, okay? Things adapt. The world adapts. And if you have something that's this constant little pressure here, they will adapt to it and they'll get more and more resistant with time. We talked about that a little bit last month when we talked about our heartworm preventions and the resistance that we're seeing in these different heartworm strains out there, and how we're struggling with treating some of those parasites. Okay, so you know, you can kind of refer back to last month's if you want, and you can kind of go into heartworms a little bit more, but it kind of just emphasizes the point that we need to make sure we're using the right dose. We need to make sure that we're using these products correctly and effectively in order to continue to get the benefits from them. So that's my little rant about getting things on the right dose, but it is really important, and I think that having that and establishing that is really good. So I really think that flea tick products are really important, and am I going to require a full exam in order to sell you one of these flea tick products? No, I'm not going to charge you for it. But what I will require is I will require the animal to come into the clinic. I want to see it walk. I want to see it be healthy, you know, coming down this way. I want to make sure, you know, that a lot of times seizures, if something is prone to seizures, it will be triggered by stress. Coming into my clinic is a stressful event for a lot of dogs. So I'm going to get to see them walk in. I'm going to get to see them be healthy, happy, normal dogs, get on my scale, get an accurate weight, and then I feel comfortable selling you the product. But I do not make you sit through a full-blown exam on the pet, and I do not charge you for that. I feel as though I'm getting a good exam on them as they're walking through, making sure they're healthy enough for a flea tick product, making sure I'm giving them the correct dose of that flea tick product, and then I feel comfortable selling it to you. But I need to make sure that it's going to work for them and it's going to be the right one and it's going to be safe. So that's why those requirements are there, and that's why we do require that. We try to make it as economical as possible for you because we do feel that these primitives are very important for our pets, and we try to make it as practical as possible while making sure that it is also safe. So that's kind of how we thread the needle there for you. We do the very best we can that way. So that kind of runs you through some differences between our flea tick products. It kind of runs you through why I require some of the things that we do. I gave you a quick rundown of what Lyme is, how the ticks get it, okay, and then they pass it on once they get older. I'm going to delve just a little bit more into Lyme really quick because I still have time. So kind of looping back, okay, so what is Lyme and what does it do if you get it? A lot of people are aware of what Lyme does in people, okay? It makes you think of arthritis, you get achy, you get sore, that kind of a thing. What Lyme does when it enters the body is the body tries to clear itself of it. And it creates these big immune antibody complexes trying to get rid of this. What do those do? Those cause a lot of inflammation. So you get a whole lot of what I would call friendly fire as they sit there and they try to rid themselves of this Lyme, okay? And that causes a lot of damage to normal cells. So that's where you get the arthritis, the Lyme arthritis, lots of inflammation there, very sore. It can also affect the liver or other internal organs. A lot of times our picky eaters or our dogs that throw up fairly regularly but then seem fine other days, those sometimes can be attributed to Lyme. The worst place it can possibly go is to the kidneys. It really wreaks havoc on the kidneys if it ends up there. and you'll see a lot of protein in the urine. Usually those pets where the Lyme has gone after the kidneys come in with severely underweight, severely dehydrated, and they have what's called Lyme nephritis. And that is the worst case scenario, and the reason I say that is because if your pet has Lyme nephritis, there is nothing I can do, okay? We've had lots of pets come in here, unfortunately, with Lyme nephritis. We've had a couple people go to referral. We had one owner go all the way down to Ohio State to get the best care. He actually got dialysis on this dog, trying to save him. He did literally everything, and unfortunately, they could not save the kidneys. When it gets to that point, when it gets to Lyme nephritis, the only way to save your dog, in my opinion, I think, would be to do a kidney transplant, okay? And unfortunately, that's something that even Ohio State doesn't do, all right? So it sucks, and that's part of the reason why we push our flea tick preventers all the time. We also carry a Lyme vaccine, and we can do another one of these and delve into vaccines if you want. That would probably be a good talk for another time, but you know, the vaccines aren't 100% effective. It's another added layer of protection, but it's not 100% effective against preventing any form of the disease. So we push the flea ticks. Best way to prevent it is to not get it. Kill the tick before it can transfer it. Make sure you're on something year round, and make sure you're on something that kills fast. So I'm getting my phone blown up here. I want to make sure I don't have any questions. All right, we did get one question. So can a cat transition from a topical like Revolution to the oral meds just within the 30-day coverage from the product, or do they need to wait a period of time before changing them? They can absolutely switch. In fact, there's no waiting period at all. In fact, a lot of times if you're going from one product to a different product, particularly we see this a lot with our over-the-counter products or prescription products, they have very different active ingredients. So you don't even necessarily have to wait that full 30 days before you would give them a different product. As long as those active ingredients are different, they should not cross-react, and they should not overdose the pet. So you should be completely safe to switch over. So if you're frustrated with your topical product and you want to try an oral one, you should have no worries. Yeah, should work really well for you. All right. I don't know what that is. Okay, so that looks like we're caught up there. So yeah, that shouldn't be a problem at all. We went through how Lyme causes all this inflammation, okay? Now, let's say, thank goodness your pet doesn't have Lyme nephritis, right? Let's say he has the regular joint arthritis, okay? Or it's affecting his liver and his gut, and he's just really picky eater. What do we do to treat Lyme? Okay, so we put him on a drug, doxycycline. Most people know that one. You have to stay on it for a whole month, okay? And then the other option is I can give him a long-acting antibiotic called Convenia, and then I have to give him that shot, and I repeat it in 2 weeks. So the pet is still getting a full month of treatment. I just do it in injectable form instead of pill form. The advantage of the injectable is you don't have to remember to give a pill. The other advantage is that it's sometimes the doxycycline can upset their stomach a little bit, okay? So anybody who's taken lots of pills before can know sometimes they don't sit all that well. So you don't have to worry about that with the shot. It's extremely well tolerated. Disadvantage, cost, okay? It costs a whole lot in order to give them that injectable antibiotic. Usually for our small dogs or our cats, the price is pretty comparable to the pills because it's weight-based. But if you start getting into your larger breed dogs, it adds up pretty quick to give them that injectable antibiotic instead of the oral pills. Also, though, luckily, usually the larger the dog, the easier it is that they have taking the doxycycline. Most of the stomach upset that we see with doxycycline happens in our smaller breed dogs. Well, usually once you get over a certain size, I think their stomach becomes a little bit tougher, and so they tend to tolerate it a lot better. So then the only real thing we have to worry about is remembering to give the pill, which can be hard to do sometimes. So we treat it with doxycycline. How do we know whether or not it worked, right? So we talked about all these immune antibody complexes floating around in the bloodstream, and that's what we look at to see if you have an active infection. That's what's causing inflammation. These immune antibody complexes, they take a long time to break down in the bloodstream. So what we do is instead of our witness test saying yes or no, we do a send out blood work. and it gives me a number value for the amount of immune body complexes. Sorry, started having trouble there. Immune antibody complexes floating around in the bloodstream. I'm going to treat them. Then 6 months later, I'm going to rerun that blood work that gave me that number. And as long as that number has dropped by at least half, I know my treatment was successful. And at that point, we're just waiting for these immune antibody complexes to finish breaking down in the bloodstream, because the body really shouldn't be making any more of them. It just takes a long time to break them down. So that's kind of how we check them. So we'll check it, treat them. 6 months later, we check it again. Can they get Lyme again? Yes, absolutely. Lyme is something that you can get bit by another tick and get it again. So just because you had it once doesn't mean that you're protected. The one thing I do get asked about as well is, what about chronic Lyme? Okay, so people hear about chronic Lyme from human side of it. Can you get chronic Lyme in dogs? Yes, you can. It's not as common, but we absolutely can get chronic Lyme as well. So how would I know if I'm having a chronic Lyme flare-up, if my pet starts to show symptoms again, versus a brand new infection? We do that by running that quantitative again, or seeing if it's maybe something completely different. Okay, it might not even be Lyme related at all. Sometimes pets tweak something. The other thing I warn people about is that with Lyme, we can usually stop the damage, but we can't reverse it. So if you get a bit of arthritis in the joint from Lyme, we can treat the Lyme, we can hopefully stop it from getting worse, but you may always need to manage a little bit of arthritis in your pet's joints from then on. Joint supplements, pain meds as needed, particularly during weather changes, a lot of those are really effective for managing arthritis. So then you go from being a Lyme dog that we need to manage or treat to just being a dog with arthritis that we need to manage and treat. And however you got the arthritis, it doesn't really matter. If you got it because you were old or you got it because you got sick, either way you have it, and so we're going to treat it. When we talked about the ones if it kind of go into the gut, do they have lifelong problems for that? It depends on the pet. They could always have a sensitive gut, okay? So pretty rare that we would need to keep them on a prescription diet long term, but it might be one where you'll find they just can't tolerate certain dyes or certain foods after you treat them for that. So that's kind of a little bit more into that. Long-term side effects, how do we know if it worked, how do we treat it, what can we do, okay? Usually, as long as you don't have Lyme nephritis, there's a lot we can do, and we can help with a lot of pets. So that's kind of our rundown. Main points that I wanted to be sure to try to hit today about Lyme. Big differences between flea tick types of products, effectiveness, usages, and why we require the things we require in order to get them on all of our options here. So one thing I did want to make sure to mention, it looks like I have a little time, so I'll try to mention it again when we're done, but one thing I want to be sure to mention is that kind of in honor of this talk, we are going to run a special on our flea tick products. And since we are introducing the Credelio cat as well, that should be up there. If you purchase 6 months, you'll get 300 points, which is about $5 to use towards your next visit. If you purchase 12 months, you'll get 750 points, which is about $12.50 to use towards your next visit. We do that with a points system because we're not actually able to just, give you money. And the way that the points work is we have an app called a Pet Desk app, and you'll get on that, and that's where it'll track your points for you, and then you'll be able to earn these points. You get to earn them for all of your regular purchases that you'd be doing anyway, or your visits and things like that. This is just bonus points that you can get, and then you can use at a later visit. So if you don't have our Pet Desk app, you probably should think about downloading it, just because it's a way that you can get free money. And you can use it here to help with purchases that you're planning on doing anyway, and it's getting rewarded for something that you're doing regardless. So if you want more information on that, or you need help setting it up, you can just give us a call here at the clinic. All right, so we kind of ran through, I went really fast because I wasn't sure how I was going to do on time today, but we kind of ran through really quick in the beginning about fleas, and then I kind of went into ticks a little bit. I did mention they have a complicated life cycle. They have a 2-year life cycle, okay? So there's going to be 2 winters that these things are going to go through, and that's why our winters being warmer really affects that tick population, and we've seen a huge boom in it, okay, is because normally, you know, they stop, but they're just keeping on going. And so they can get a lot more babies in that way, especially with a longer life cycle. All right. So without any other questions, I'm going to kind of keep going here. I really briefly touched at fleas and about the different products and everything when it comes to fleas. So I'll kind of circle back because fleas are something that we still see. And a lot of times people don't talk that much about, you know, the nastiness of fleas, right? So I briefly mentioned how some of the older products will see flea bite dermatitis and those types of things. What that is essentially an allergic reaction to a flea bite. Okay, so if you're really, really sensitive to a flea, then you're going to scratch like crazy. So think of it, if you, sometimes you get bit by a mosquito and you get like one little bump. Other times you'll get bit and it just drives you crazy. And you'll scratch enough, you'll tear yourself open, or you'll get this rash. Same thing. So it's basically like an allergic response to the saliva of the flea. And the pets just go crazy. Particularly cats. I see most of my flea bite dermatitis problems in cats, and they will tear themselves up to the point where they're bleeding, they get secondary skin infections, and the fleas are just nasty. In cats in particular, you will not always see a flea, and that's because they're such fastidious groomers. They will groom that flea off. They will tear themselves up trying to find any little flea on them and make themselves squeaky clean, and they'll tear themselves up in the process. They'll lose all their hair. So with those guys, just because you don't physically see a flea on them, it's because they're over grooming, but you'll see the results of it. One of the things they always talk about is what's called the pants off region. Okay, so if I took a pair of pants and I pulled them on the animal and it covered everything up, and if you just had that on the animal to look like a normal animal, that's probably fleas. Okay, usually if they're itching like crazy, you have all these problems down there in the back end, because that's the easiest place for the pet to reach. Not that the fleas aren't biting other places, but that's the easiest place for the pet to scratch and go crazy at. You'll see all these flea bite dermatitis there on the back end. So if it's in the pants, okay, then it's probably fleas. And you put them on a topical product, you do need to use it again for 3 months to break that flea life cycle, and then they should be good to go. Obviously, especially if your pet is that sensitive, you're going to want to keep them on something. What is my problem with the older flea tick products? Okay, so they don't kill fast enough to kill the fleas before you see all this flea bite dermatitis. And usually, from my experience with the older topical products, the flea still seems able to reproduce. Now, less is killing it. It's just not killing it fast enough. And so you continually get this kind of low-grade flea infestation. You're never going to get a really big major one, but it's going to be this low-grade flea infestation you can never really seem to get rid of. And I think it's because those adult fleas are laying their eggs, at least like one batch or something maybe before they die. Okay, and it's enough. If you have a pet that's sensitive, it's enough that they're still going to be tearing themselves up and they're still going to be having all these problems. The other thing with fleas is you can get enough of them that it can actually make your pet anemic. Okay, and so once your pet gets anemic, then they can run into all those types of problems as well. Okay, just because of sheer blood loss, parasites and all of that. Have I ever seen a pet have that many fleas to become anemic and actually be critically ill as a result of that? Yes, I have. Do I think the pet also probably had worms and other problems as well? Probably. But the main thing that we'll see is they seem to just get this horrible infestation of fleas. One of the tricks you can do, if you're curious if your pet has fleas or you're not sure, you can take a flea comb. As I mentioned, fleas don't live on the pet. You may or may not get an adult flea, depending on how bad your infestation is. But if you take a flea comb, you go with the hair, you go against the hair. A lot of times you get this little black dirt. Just looks like dirt, okay? If you put that on a white surface and you spray it with hydrogen peroxide or alcohol or something like that, it should bubble up and it should turn red, okay? And the reason being is that flea dirt is actually dried blood or flea poop, because the fleas are biting you and then they're pooping out the dried blood. And so that's the way that you can kind of do a little check at home. If you're like, man, is my pet just dirty or does he have fleas? That's something simple you can do. You can kind of break apart flea dirt from regular dirt. Regular dirt is just going to stay nice and brown. Flea dirt is going to turn red on you. So do flea baths and flea shampoos and all that stuff work? I mean, they kill them while they're on the pet and the pet is wet. Once the pet dries, they really don't seem to hang around very much, okay? So they will not keep your pet protected and keep them stemmed. It seems like once they dry, they all just jump back on. A lot of people ask me about Dawn dish soap baths. It's kind of the same thing. Dawn dish soap kills adult fleas because it gets really bubbly and they basically drown in there. But once your pet's dry, they just get back on and enjoy a nice meal. So it's kind of a nice little break, I guess, for them. You can give them a little bit of a break before they get a bunch of fleas back on them, but it's not really treating your flea infestation per se. So we kind of go through all that. It looks like everything's going pretty well. If anybody has any other questions, I can answer those. I would say the main external parasites we see tend to be fleas and ticks. Don't really see a whole lot of others, at least around this area. Do we get mites? Yeah. Ear mites will tend to go after our outdoor cats, and they'll live there in the ears. They are very contagious among cats. Okay, so if you have one cat that gets ear mites, it's very easy for them to pass it on to another cat with ear mites. How do you treat ear mites? The best, most effective way to treat ear mites is to use a topical called Revolution Plus. One of the nice things about that is it's also a flea tick topical. It also gets mites and other pesky parasites like that too. You do need to use it for more than 1 month to fully get rid of your ear mite population and completely rid itself of that infection. But it's probably the best way to go. We do mix up an ear mix here that we can sell as well, that you topically have to put in the cat's ears. Most cats really kind of hate that though. They'll let you do it the first couple times, but when you have to keep doing it, they catch on pretty quick, and it gets harder and harder to catch them in order to actually treat the ear mites. So that would be something to consider as well. If you have a pet that's an outdoor cat coming into contact with other cats, you know, it's not just fleas and ticks you have to worry about, there are other parasites too. And one of the nice things is that if you use a product that is shown to get mites or other worms and things like that, it's a little bit better for those just because they're exposed to so much more, and then you don't have to worry. So the downside with Revolution Plus, it is a 30-day topical product. A lot of times outdoor cats that are the most likely to get exposed to these ear mites are more difficult to catch. And so if you can use a longer acting product, a lot of people like that a lot better. They need to catch their cat less. Does the oral flea tick I just talked about, the Cordelia, does that cover ear mites? It's not labeled for it, and it's new enough that I don't know if it has a secondary effect or an off-label effect of killing ear mites or not. That's something we'll just have to find out in time. Sometimes these newer products will end up getting more than what they're labeled for. They just didn't go through all of the rigorous testing to make sure that they get that label for it. Speaking of getting labels for stuff and going through rigorous testing for it, getting labeled as safe for pregnant or lactating, those types of things, takes a lot of testing and a lot of time, and that means a lot of money for the companies as well. So a lot of products are just not tested in pregnant or lactating animals. The one product, Bravecto, that I mentioned has been tested in pregnant and lactating animals and has been found to be safe. A lot of our heartworm preventatives have been. They've been out there long enough that research was done. Several of the other oral flea tick products, it just was never tested. So we just don't know. A lot of times you'll also see that things aren't tested that rigorously in cats. And a lot of it's just a money thing, okay? So there's more money in dogs. A lot more people are willing to spend money on their dogs than they are on their cats. The majority of cats out there in the world are barn cats or outdoor cats, which people love, but they don't want to put a whole lot of money into, okay? So they're just not selling as much of the product. So for example, trying to think if the only flea tick product out there on the market that was tested in cats for pregnant and lactating is actually Frontline, and it was found to be safe, but we just don't know with any of the others. Are they safe? Probably. They seem to be very safe as well as effective, but it's just something that was never tested, so we can't say for certain. For example, Bravecto I mentioned was tested in dogs for pregnant and lactating. It just simply was never tested in cats. So their cat product, who knows? It's the exact same product they use in the dog. I would say you're probably safe, but you just don't know. Sometimes cats just act a little bit differently than dogs. So that kind of runs through ear mites. Other things we'll see parasite-wise on this outside of the skin are different types of mites that cause mange. So there's sarcoptic mange, there's demodectic mange. Sarcoptic mange, you're going to know if your pet has that because they're going to be really, really itchy, okay? So they're really going to go after themselves. They're going to be ripping their hair out, that kind of a thing. We usually do a skin scraping for that. So if you bring them into the clinic, we'll take a little scalpel blade, do a skin scraping, look at it under a microscope, see if we see any mites. That one's not nearly as common as demodectic mange. This is going to be a mange where all your pet's hair is just going to start falling out. It's not going to be itchy. It doesn't seem like it's painful. It doesn't seem to be bothering them, but they're just losing all of their hair. So you bring them in. Again, we do a skin scraping. We look at it under a microscope. And if we see these little demodectic mange guys, they look like little cigars because where they live is they live inside the hair follicle. And that's why the hair follicle falls out when they get overpopulated. And so what do we do for those? One of the nice things about those is that a lot of our oral flea tick products that I talked about, they're not labeled for it, but they seem to be very effective at killing mites, sarcoptic mange, controlling demodectic mange. Demodex is unique in that most animals have demodex in the hair follicles of their hair, and it's just hanging out. The only time it becomes a problem is when it overpopulates, and then your hair follicles start to fall out. So if you get a pet that gets demodectic mange, okay, you put them on this oral flea tick product, it gets it down, the hair goes back, everything's awesome, and you take them off the product and then all their hair falls out again, it's because the demodex is normally always there. The product just kept those numbers low enough that it didn't cause the hair to fall out. It's considered a natural mite that just lives in, I probably have it. But my hair doesn't fall out because my immune system is strong enough to keep its numbers in check without help. So the pets who lose their hair from it and need some help with an oral product, their immune system for some reason just doesn't keep these little buggers in check enough and they overpopulate. So that's why if you have a pet with this, you put on this product, it's amazing, you take them off and all their hair falls out again, that's why. It's because that mange is a little bit unique in the sense that it's not considered an infectious mange at all. It's because it's more of an individual problem, keeping a normal mite that naturally lives there under control so that you don't lose your hair. So that one's another mite that we see a lot. We'll see other weird skin things that aren't bug related at all. Some of them are autoimmune, those types of things. Dermatology in pets is very interesting, and that's, you can get really deep into that. But trying to think more of the parasitic things that we can see that we can treat and prevent and get rid of. Those are, I would say, the two main manges that we would see. And a lot of times if you bring us a pet that we're suspicious of one of those and we don't necessarily see something in a skin scraping, we'll probably end up putting on one of those oral products just to cover it. Okay. Same thing with I mentioned the flea bite dermatitis and having that pants region. Okay. Even if we don't see fleas, we don't see flea dirt, we'll probably put you on one of these oral products just to double check and make sure, because it's not going to hurt anything, and you sure would hate to miss treating something that was so easily treated and so easily prevented. Can you see these same types of patterns with just a regular allergy? Yeah, absolutely. But you don't want to, commit an animal to lifelong allergy management if you don't have to. If it's something infectious, if it's a parasite or something that we can get rid of, then absolutely we're going to want to see if that's it first. And if that comes back as, okay, well, this is more of a long-term thing that allergies are going to need to manage, then we'll start doing that from there. But we want to make sure we've ruled out all the stuff that we can actually cure before we get them on kind of a lifelong management thing. So just to kind of recap here, I think we've done a pretty good job covering the main things we see. The main parasites that we see attacking our animals are fleas, ticks, a couple different types of mites. One note as my brain is working here is with the ear mites. I mentioned we see it a lot in cats. Can you see it in dogs? You can, but it is really, really rare. Most dogs just end up having a mixed bacterial or a yeast infection in their ears. It is very rare for them to actually have an ear mite infestation in their ears. Does it jump from cat to dog? Very, very rarely. I mean, I'm not going to say that it doesn't happen, but it is very rare. Ear mites really seem to like cat's ears. They really don't seem to like dog ears. I don't know why. Nobody's studied ear mites as much as some of our others. Probably because they're really not that hard to kill. But I rarely see it in dogs. I see a lot of dogs come in the clinic that have been being treated for ear mites over the counter, and it's just not getting better. Well, that's because it wasn't ear mites. It was just a run-of-the-mill ear infection. The other thing I'll say that I see a lot coming through my door is dogs and cats that have been treated with over-the-counter ear mite medication, and they come into my clinic and they have a yeast infection or a mixed bacterial infection in their ears. Could they have had ear mites before? Maybe. It might have never been ear mites, or maybe it was ear mites, but because of whatever that topical was that they put in the ears, it gave them an ear infection. They killed the ear mites, but it gave them an ear infection. So I don't know which one it is. All I know is that I see that a whole lot. So if you're using an over-the-counter ear mite treatment and it's just not getting better, or it changed, but your pet is still very uncomfortable, it's probably got an ear infection. So you definitely want to bring him in, have us look at that, and get him on something to clean that up. You might have potentially successfully cleaned out the ear mites, but it left something behind, okay? And so we'll see that too. So kind of, I guess we'll start over with this recap. We talked about fleas, we talked about ticks, we've kind of covered ear mites, we talked a little bit about sarcoptic mange and demodectic mange. One of the nice things about all those is that our newer flea tick products do cover them, okay? Does every single one of them cover every single one of those? No. Which one would we recommend for you? It'll depend on your pet. It'll depend on exactly what we're most worried about with that animal and the practicality of giving it. We've got a lot of options out there. We got topicals, we got orals, and they've all been tested. They're all safe and they're all effective. Biggest things to remember are speed of kill. Faster it kills it, the happier I am. And then safety, okay? Those are our two big things. And as long as we have those, your pet should be well protected and everything. I'll just mention briefly again that we are running a special on all of our flea tick products, trying to get everybody covered, everybody safe. If you purchase 6 months, you'll essentially get $5 off your next visit based off of points. If you purchase 12 months, you'll essentially get $12.50 off. And you'll get that through points through our Pet Desk app. And that's just how we keep track of it for you. And you'll get up points for other things as well, just regular visits, money you spend in anyway. It's a way you can get money back, and you can use it here in the clinic to kind of decrease the cost of everything. So with that, I will bid everybody good night. Thank you for watching. We should be running another live event next month. I'm not sure what the topic is quite yet for that one. We'll kind of see what we're looking at and come up, and so look for that announcement as soon as we figure out what we're going to be talking about next month. We are always welcoming suggestions. We want to teach you about what you want to know about. So I try to pick things that I see a lot coming through the clinic that, you know, Lyme I get a lot of questions about. I get a lot of questions about why do I have to bring my pet in for weight on these new products, you know, why isn't this working, why isn't that working? So I try to use that to figure out what to talk about, but if there's something specific you want to talk about, please let me know. I love suggestions, I love questions, and I look forward to seeing you all next month. Thank you.